Hello and welcome back to Focus Atlanta. Again, I am your host, Keisha Lancelin. Thanks so much for continuing to watch.
Sickle cell disease is a genetic disease. It's an inherited disease. So you get it because your parents pass it on to you. And the type of sickle cell disease that you have is dependent on what traits and what genetic material that you get from your parents. The most common type of sickle cell disease is called homozygous sickle cell disease, where you receive a sickle cell trait from mom and you receive a sickle cell trait from dad. There are other types of sickle cell disease, including SC disease and S-beta thalassemia disease, and they can differ in severity depending on what type you have. The most common symptom that a patient with sickle cell disease will experience is what we call a pain crisis. And that is basically where a certain part of their body will all of a sudden develop, severe or significant pain. And they often need to come to the hospital to be treated for. But there are a variety of different symptoms and different consequences of having sickle cell disease. I always like to tell my patients that because it involves the blood, wherever your blood flows is where you can get a complication of sickle cell disease. So you can really see complications from the top of your head to the tip of your toes with sickle cell disease. So a pain crisis is basically caused by the sickled red blood cells that these patients have. So these sickle cells are basically shaped like a C or a sickle, instead of this nice round shape that we expect to see in a patient without sickle cell disease. And because they're shaped so abnormally, instead of flowing through the blood, very freely and easily, they get clogged in vessels, and that causes a lot of pain, causes a decreased oxygen to the tissues that need to get oxygen, and that's really what causes the pain that patients feel when they develop a crisis. Because sickle cell disease is different for every patient, we do try to educate them about recognizing their own personal triggers, and that can be different for every patient. But there are some things that we know tend to trigger pain crises in patients. Changes in weather, going from hot to cold, stress can trigger the body, and it can be any kind of stress, mental stress, emotional stress. All of those things can trigger a pain crisis. Illness, if they have a fever or anything like that, that can all trigger a pain crisis. So we try to tell patients to, dress warmly, try to, prevent catching illnesses as much as possible, drink a lot of water, things like that to hopefully prevent pain crises. And then once they develop them, of course, there are a variety of different ways to help treat those once a patient develops a pain crisis. There have been a large amount of blood shortages with COVID-19, and it has had a huge impact on our patients with sickle cell disease. I remember early in the pandemic, patients who were on the chronic transfusion protocols were not able to get the blood they needed in the time that they needed it because of the blood shortage, which of course is dangerous for these patients who are at risk for stroke and things like that. So there have been, situations where we've had to stretch care a little bit because of the blood shortages that we're seeing. So we absolutely want to encourage people, even during this pandemic time, to make sure that they're donating blood, because there are patients like our sickle cell patients who really rely heavily on those blood transfusions for management of their disease. So I think when people think about donating blood and matching blood, we tend to think of making sure that we match blood on blood types. And that is absolutely important. But there are also a lot of hundreds of proteins associated with blood cells. And a lot of these proteins are unique to certain racial and ethnic groups. And African American people and people of African descent do have some special unique proteins that is associated with their red blood cells. And so it's absolutely important, in order to prevent any kind of rejection of donated blood, that we're able to match those patients well. And the best possible chance of matching is often by having donors who are similar in racial and ethnic background.
The Red Cross currently provides free sickle cell trait screening on all donations from self-identified African American donors. To learn more about your eligibility to donate blood, visit redcrossblood.org and click on the eligibility tab. To schedule an appointment to give blood or even host a blood drive, visit redcrossblood.org/ourBlood. To learn more about Dr. Elamine and the work she and her colleagues are doing to support patients with sickle cell disease through the Sickle Cell Program at VCU, visit vcuhealth.org.
Thanks for tuning in to this segment of Focus Atlanta. Please stay tuned for more.